At this point in the scene, you may have noticed several opportunities in which the dermatologist could have interacted with the patient to prevent her from coming in without any resolution to their concern. We will go over some of the statements made by both the dermatologist and the patient to highlight opportunities to create a more equitable, culturally humble patient interaction. In the dermatologist's internal dialogue, attention is drawn to the hairstyle. The dermatologist is aware he is not knowledgeable on this hair type, and for that reason, hopes the concern is not regarding hair. Being culturally humble requires self-awareness. This is an opportunity to lean into awareness of this hair type and learn instead. Next, in the patient's response to sharing her symptoms, she thinks about the perception of her hair. She may feel that way because of the stereotypes of having curly or kinky hair. Differences among others can make people feel uncomfortable, insecure, or untrustworthy of others' understanding. In this case, it is important to understand that patients may feel insecure about their hair type or other differences. These stereotypes are negative and can affect a patient's experience. Let's look at another. Here again, the patient is assuming they will be judged for not following society's norms instead of what is practiced in her culture. For instance, washing hair less frequently in some cultures is a norm due to hair being prone to dryness. Next is a two-part consideration. We see the dermatologist think to themselves about the frequency of her hair washing because it is atypical to him. This is an internal thought that doesn't mean he's being judgy or is not a bias. The surprised nature of the physician highlights he has a gap in knowledge, which means this is an opportunity to learn. In his statement to the patient, he suggests she wash her hair more without understanding why the patient chooses to wash less frequently. Asking why or asking for the patient to tell you more is important because 1, it adds justification and value to a patient's experience. And 2, asking such questions also helps to build a relationship between the patient and physician. In this scene, we see the patient say to themselves that they will not implement the suggestions exactly as the dermatologist stated. The patient knows what's best for her hair type, and therefore not following the dermatologist's suggestions should not be considered non-compliant. A part of being a culturally humble and sensitive healthcare professional is also meeting the patient where they are, so they are comfortable with the treatment plan. In the next scene, we see that the dermatologist wonders what protective styles are, but does not ask the patient. For the purposes of this video, protective styles are low manipulation hairstyles that allow for textured hair to retain moisture and limit exposure to damaging environmental effects. If the dermatologist had asked about protective styles, he would have gotten more insight and likely would have not recommended the treatment originally prescribed. Asking about protective styles and why the patient may use them would fill in considerations that the patient was insecure and bridge a gap for them to communicate more clearly and openly. Instead, the dermatologist may have said, "What is a protective style?" An additional benefit to this inquiry is patient empowerment to be vocal, share, and teach the derm about patient's culture, which could create a more positive patient experience for co-creating a treatment plan. Further, unique cultural practices have implications that a physician should explore. It is nice to be supportive of a patient's cultural norms, but a physician must ask questions to understand the implications. For example, protective hairstyles are not always protective, and physicians need to understand not only what they are, but in which ways they should be done so as to not further contribute to alopecia or other dermatologic conditions. And finally, in this scene, the patient is surprised that the dermatologist never examined her scalp. This may have caused the patient to feel a sense of neglect and dismissal. The patient could have asked for a physical exam before exiting the patient room. However, the patient likely may not feel empowered to direct or guide how the visit went. The patient leaves unassured about her next steps. So, what do you think? What would you have done differently to make this a better experience for the patient? In what instances do differences stifle you from connecting with patients and providing them with the treatment they need? We hope this video highlights cultural humility in patient interactions that was impactful.